Well, with just 1 week before the start of school, concerns are rising around a new variant of COVID-19 amid an already crowded list of respiratory infection risks for students. Usually, back to school coincides with respiratory infection season. And for students who are at risk of COVID, the flu, colds, and RSV, it's better to be safe than sorry. This comes as BC has detected Canada's first known case of a new COVID-19 variant that has swiftly circled the globe, the BA.286 variant of the Omicron strain. So, as kids prepare for the return of classes and the likeliness of coming across some runny noses and dirty hands, how can parents reduce the risk of infection? Well, joining us now in our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great to be here.
So for many kids, it's back to school, and for many parents, it's the most wonderful time of the year. But it won't be that wonderful if your kids get sick, Dr. Raut. So let's talk a little bit about these risks, starting with the BA.286 variant of Omicron. So why has this particular variant made its way to the WHO's list of variants under monitoring?
Right. So this variant, also known as Pirola on social media, has gathered a lot of attention because of its potential for increased transmissibility. Variants like this one, we usually closely monitor them. But this one in particular, we're worried because it does contain some mutations on the spike protein of the virus, which definitely impacts the ability to evade the immune response or even enhance its ability to bind to human cells. But research is ongoing. We don't know exactly how potent this variant is going to be with these mutations, and that's why it's got the WHO designation for under monitoring so far.
All right, more to learn about this variant. Now, what about this EG5 variant, which seems to be spreading quite rapidly across the country? What do we know so far about this strain and its severity?
Right, very rapidly indeed. So looking at data from the CDC and Public Health Canada, we would estimate that maybe 20 to 25% of cases of COVID-19 at the end of August, both in Canada and the US, came from EG5, also known as Eris. It doesn't seem to be too different from other strains. EG5 is really a descendant per se of the Omicron variant, which came out in November 2021. It also has a new mutation on its spike protein, and that again, we worry about the ability to evade immunity, and it happens to be the dominant strain at this time.
And what do we know so far about how these COVID variants may interact in children's bodies in particular?
Right. So we are definitely going to see a lot more children being affected just because of back to school in general. And children, like adults, can contact and transmit COVID-19 variants. We do know that for children's bodies, there's a higher transmissibility in general. And severe illness may be a bit less common in children than adults, but not absent. There are certainly cases where children are quite greatly affected. And what we're seeing is whether these variants will make a huge impact for children in particular, and that's something we're watching as well.
All right, Dr. Raut, let's talk about some other conditions that put students at risk, including RSV. So where are we at when it comes to the risk of RSV infection for students in particular this back to school season?
Right. So pre-COVID and even during, RSV does cause these yearly outbreaks of respiratory tract disease in Canada, usually late fall to early spring. It's one of the most common cause of lower respiratory tract illnesses in young children. And the children that are most affected or most at risk are actually children less than 2 years of age. And they can get more severe disease like bronchiolitis or pneumonia and may actually need hospitalization.
And what are your thoughts on the classic cold and flu categories this season, Dr. Raut? Is that a big concern for you?
I think the big concern here is we have COVID-19, RSV, influenza, and colds, all transmitting in crowded settings like classrooms, all having similar symptoms and all having an impact on learning and spreadability to high-risk groups. So definitely there is a concern because we're going to see not only all of these illnesses, but also some people having multiple, and we have to deal with that in an emergent situation.
A huge concern indeed, Dr. Raut. So what kind of steps can parents take to not only protect their kids, but themselves from respiratory infections as kids head back to classes?
Right. So the steps we really need to keep ourselves free from respiratory infections are hand hygiene, respiratory etiquette, so coughing into your elbow or tissue, masking in high-risk places, avoiding sick individuals, and staying hydrated. Now, I explained this to one of my 3-year-old patients, and she sneezed in my face. So what that means is parents are really going to have to make sure that their kids are vaccinated instead and put these things in place. We're also going to have to make sure they're well hydrated. and good nutrition in order to keep their immune system strong.
Another great interview, Dr. Raut. Thank you again for your help.
Great. Thanks so much for having me.